Good afternoon, all. My name is Efakeni Moronta, and I'm a family nurse practitioner student from Franklin University. And this afternoon, I will be offering an brush strokes about a subject who affects us, which is chronic obstructive pulmonary disease. I will try to present the key points of the research that I carry out in a plain and understandable way because my goal here is that everyone has a very idea of the main symptoms of this condition, how to recognize a crisis that required emergency treatment, and the importance of following the treatment.
All right, let's start. Chronic obstructive pulmonary disease is a prevalent disease nowadays, and it is not nothing more than the damage that certain irritants cause to the lungs, causing cough with a lot of phlegm, difficulty breathing, a sensation that something is on the chest that does not let it breathe completely the patient, a strange whistling sounds called wheezing or another complaints. This disease is called progressive. Why? Because it gets worse over the time. This disease is closely related to tobacco use, but it's not the only case, etiology. And there is even more people who develop this disease even never in her life smoke. Long-term exposure to substances that irritate the lining of the lungs, such as chemical fumes, pollute air, dust, or tobacco, can cause this disease to occur. Also, and a small number of people who born without a substance in their body called alpha-1 antitrypsin that helps the human body to recognize microorganisms can harm it and prevents them to decomposing it. When this substance is not in the people body, they can present liver or lungs disease, such as COPD or emphysema. Many people who are treated for COPD do not follow their therapy continuously, so the effectiveness of this treatment is reduced. That is why it is essential to know the belief of the patients towards the medication, their experiences about the efficacy of this medication, their problems with the associated side effects, the cost effectiveness, that is that they can buy or acquire the drug relatively easy, and if they consider that they can improve their quality of life. A study carried out in patients of different social classes report that as a final result that more than 50% of patients with the chronic obstructive pulmonary disease do not follow their treatment as it was prescribed. Therefore, it is necessary to explain the condition, why what causes not following the medical treatment, and the possible remedies. It should be mentioned that communication between the health provider and the patient is vital to generate trust and continue their treatment effectively. According to research conducted by ARI in 2021, they agree that COPD affects many patients, doctors, and caregivers worldwide. The severe case of the COVID-19 pandemic shows why COPD treatment is mandatory. Unfortunately, there are not studies on using COPD drugs in patients who are also infected with COVID-19. Treatments for COPD patients at home are necessary to reduce the challenges of COPD. Part of the COPD treatments are inhaler pumps and nebulization to help these patients breathe more effectively. And this research also explained how it's preferred to use pump than nebulizers. Why? Because the transmission is less, since only one way is being used, that is the mouth. And nebulizers, we use both. Within the treatment of chronic obstructive pulmonary disease are oxygen. to help the patient breathe more accessible, and bronchodilators, drugs that can help the lungs allow oxygen to enter more easily. If there is a crisis, the management will depend on its severity and medical criteria. It is important to mention that early recognition of COPD crisis is vital when treating these patients. Symptoms such as severe respiratory difficulty, the low of oxygen in the blood, and extreme fatigue should be reported immediately and go to the healthcare center nearly. Medical studies show that as long as the patient shows about his disease, better results are obtained. 20 over 100 patients with chronic obstructive pulmonary disease who are hospitalized died each year. The government and the health department must create new policies to improve these results. Due to the majority of COPD patients do not follow their treatments as recommended, hospitalizations and respiratory crises are very common and decrease the quality of life of these patients. That is why new treatments ideas continue to be created to improve the quality of life of these patients and integrate them so that they can be part of their management and find better results. These investigations are under constant study to be validated and accepted for use with patients. Chronic obstructive pulmonary disease is the third leading cause of death in the last 10 years. And that is why reducing the crisis of this disease, continue to be a tremendous challenge for all health personnel. Thank you guys for watching this. I hope that I was understandable what I say, and thank you so much for your time.